Do you know what is sciatica? Sciatica is compression of the sciatic nerve. Now, what is a sciatic nerve? There are nerve roots that comes out of spinal column and it makes the sciatic nerve. Then sciatic nerve travels behind the back and passes through the buttock area. Then it goes behind the thigh and behind the knee. It splits into two nerves. One is the tibial nerve and the second is the peroneal nerve. Peroneal nerve is in the front part of the leg and the tibial nerve is in the back part of the leg. When it is injured or irritated, it can cause and radiate the pain from the buttock to the leg, and it can feel like a sharp shooting pain or electric sensation. Primary cause of the sciatica is usually the disc herniation, but it can be also caused by facet joint arthritis. It can be caused by infection, irritation. Infections like herpes zoster can create irritation to the nerves and affect the especially nervous system. If it is compressing the sciatic nerve, you usually feel pain shooting down in the buttocks or the leg, or it can go up to the ankle or the foot. If it is not treated, it can damage the nerve permanently. Diagnosing the sciatica is very important, and it is the complex diagnostic criteria. So when you see your doctor, they will test your reflexes, muscle strength, sensation, as well as some red flags. If there are red flags like issues in the bowel bladder functions, bilateral numbness, bilateral weakness, and the pain going both sides legs, then it needs to be consulted with the specialist. Once you diagnose the sciatica and it is not very severe or not spinal cord injury, then we can treat it. I'm going to show you 3 effective research-based exercises to work on those sciatic symptoms. Exercise number 1 is called passive extension of the lumbar spine. This exercise was very well researched and showed way more results than manual therapy. For this exercise, you go on your tummy and bring your both hands away from you, and then you're going to lift your shoulders up and then bring the elbows towards you, and then you can go higher as much as you can. Here we have to remember that it is not actual pushing motion, it is lifting your shoulder or upper body and keeping the hips down. This is called passive extensions, meaning there is no muscle activation happening, it's only the joint movement, and this is where it helps the prolapse or bulge disc to push forward and then decrease the load on the sciatic nerve. And here we have to make sure that if you have a back arthritis or facet joint arthropathy, then this exercise may not be right for you. You need to consult your doctor or your physiotherapist. Now, this can be done 10 times in the morning, evening, afternoon. If you do more, there is nothing wrong, but try to do at least 10 repetitions and don't go over. And you can increase range by going and bringing your elbows straight and then lifting yourself up more and more. Second exercise is standing back extension. So this is similar as your prone extension, but you're doing in a standing. Now, if you can stand, this exercise can be good as well. If you have to drive a lot, sit a lot, then this can be done while on the go or walking. So what you do is you place your both hands on the buttocks, and then you're going to extend or arch your lower back backward, and then you can do this 10 times. Make sure here we don't push the hips forward, we only do the back extension, which is going to help improve the space for the nerve root by pushing the disc out of it. With the sciatic nerve root pinching on the one side, this can make your back go sideways, and to treat that we need a third exercise, which is called lateral shift. So when the root comes out and if it is painful, body is guarding it and protecting it, and that is painful, so we avoid that motion. So it starts to bring your hips out on one side and you feel like you are crooked or twisted. So here what you do is you go towards the wall on the side, facing the wall sideways, and use the normal side. So you go hands on the wall on the normal side, and then your affected side will be away from the wall, and then you're going to push your hip towards the wall gently. This might increase the symptoms because this is the one of the pinching position. So if it does, we can take it easy and it not be right time to do this. So this can be done 10 times, and this is going to start correcting your posture, your gait, and walking as well. Now if you like this exercise, you can repeat this. And a lot of time just the exercise doesn't make a difference, then you should consider having anti-inflammatory, pain management, ice pack, hot packs, or even diet. If you like to check out the inflammatory diet, please check this video here, and then you can also look into more about the diet options if you are having arthritis, cervicogenic headaches. Thank you.